Hi all, welcome back. So we left off, we were talking about the endocrine system. The first lecture we were talking about the types of hormones, okay, some being lipid based, some being protein based. Okay, then we went through and we talked about the pituitary gland and the hypothalamus and how the pituitary gland is stimulated and what kind of hormones it produces. And one of the tracks from the pituitary gland is the thyroid gland. And so we're going to talk a little bit about the thyroid gland um, in this series of lectures. Okay, so there's two lateral lobes to the thyroid gland that connect are connected by an isthma or isthmus, and it lies just below the larynx, okay, and interior and lateral to the trachea. Okay, it does have a special kind of capability, and that is to remove iodine from blood. And we may or may not talk about that in, well, we definitely will talk about that because there will be some examples later about the iodine. Okay. It produces three main hormones, okay, thyroxine, triiodothyron, okay, and calcitonin. Okay, T4 and T3. We will spend a little more time on these, talking about these, but calcitonin we already talked about. Remember back when we talked about how bones get established and bone material, and really the calcium kind of pathway, and calcitonin is part of that hormone for that calcium pathway, or to determine whether or not calcium is going to be laid down or taken up. So the secretory cells, or the cells that are going to excrete the hormone, are called follicles. And so we normally call it a follicular cell, or follicular cell layer. And this would be the layer that's going to excrete these three hormones. And the reason why I bring that up is lots of diseases, disorders, and cancer can occur in the thyroid gland because of the single layer of cells. You can see damage to that quite often, and you can see tumors or, uh, yeah, just tumors develop there, or cancerous tumors, malignant tumors develop in the thyroid. Okay. Um, And then there's another set of extrafollicular cells that lie outside the follicles, and we'll kind of look at that here. Okay, so this is what I'm kind of talking about. This is what I'm describing. So you have the thyroid gland. It's kind of got two projections that come up, the isthma that's in between, that kind of holds those two lobes together. If we dive into the lobe, you have a colloid, which is this open space. And one of the ways to know if someone has um, cancer in the thyroid is this space won't be there any longer. That uh, that colloid, that empty space where a lot of the hormones are going to be deposited initially, won't be there any longer. So you have these follicular cells. These are the cells that are going to excrete material, and then you have these extra follicular cells that occur on the outside that are more protective, more supportive around the outside. Okay, so looking at things like the thyroid gland, if we dive in again, you have these follicular cells, single layer, okay, the colloid, and then protective or supportive cells on the outside, the extrafollicular cells. Okay, so if we look at normal cells, you should be able to see that colloid. Then when you start looking at things that have been damaged, so types of cancer. So when we look at papillary cancer, then they colloid is gone. The follicular cells are still there, but it has this kind of elongated structure to it. There's a lot more space, empty space. The nucleus of the follicular cells change shape and size, and so that's one of the key components to that disease. Okay, the follicular disease. Okay, similar in that a lot of the colloid region is gone, but you can still see it in some regions, but it's not uniform any longer. So you don't have that uniformity. It's not there anymore, and it's more spotty in different regions, and then multiple cells in there. The nucleus don't really change. Okay, it's just the architect that changes in the system. Okay, and then undifferentiated. Okay, then you can't tell the difference really from other regions, and so it's non-typical. The colloid cells are kind of gone. It looks like just a bunch of extra follicular cells that are in that region, and so it's kind of losing its function. So in all these cases, the function has been lost, and it's not normal, but different ways at which you can present kind of cancerous cells in these areas, or damaged cells in these areas. It's not always cancer. It can be disease related to other things that are going on. So disorders that are associated with the thyroid gland, you can have hypothyroidism. Okay, that's an underactive, or you can have an overactive, which is hyperthyroidism. Hypo, often what you would see associated with that is things like weight gain, high cold sensitivity, lower metabolic rates, which is associated with that weight gain. Typical high fatigue. Okay, and then in children you can have issues with, because of the metabolic rate and things like that, you can have problem with bone formation and growth in general. Okay, hyperthyroidism, you can expect to see pretty much the opposite of hypo. Okay, you have a higher metabolic rate, restlessness, weight loss, overeating, because you're always hungry, and this can be caused by non-cancerous thyroid tumor. It also can be caused by a few other things, like certain types of medication, autoimmune diseases, other things that are associated with it. Okay, and just there are some like ways at which you can see some of the thyroid diseases. A lot of the thyroid diseases will have a swollen region. The thyroid will be swollen because it's either proliferating cells or it's not acting as it should, so it typically enlarges, except for the infant hypothyroidism, where you just see some of the clinical things that were talked about before. Okay. So parathyroid glands, these are glands that are associated with the thyroid. They occur on the outside of the thyroid, so the posterior surface of the thyroid. Most people will have 4 parathyroid glands. We already talked about the parathyroid. Remember that the parathyroid is producing PTH, or parathyroid hormone. Okay, this is going to regulate calcium and phosphate levels within the body. So again, the thyroid is really important for bone growth. It's important for maintaining calcium. And if you're maintaining calcium, then it's associated with that nerve function. So if you have low calcium levels, you have low capability for action potentials. So a lot of things that are associated with the parathyroid and the thyroid glands. So the action of parathyroid hormone, just to recap, we already talked about this when we were talking about bone, but it increases blood level of calcium. and it decreases phosphate. Okay, so if you have low levels of calcium in the blood, parathyroid hormone can help with deteriorating or consuming bone material to increase the calcium. Not just bone, but it also can affect the kidneys to stop excreting calcium and your intestines to stop excretion of calcium. Okay, so lots of things that can happen. So it can act on bones, kidneys, intestines, like I just said. It can stimulate the reabsorption of bone material. It can act on the kidneys to produce vitamin D, but also to not release calcium. So and excrete more phosphate into the urine. And then it can also stimulate kind of the intestines to absorb more calcium and not cause you to defecate out calcium. And of course, we've talked about the role that it plays in vitamin D, or how it might be linked to vitamin D when we were talking about bone. So where will you find the parathyroid? Remember, most people have 4, but that's not always the case. So if you don't have 4, it doesn't set you back necessarily. But posterior side of the thyroid gland, okay, so the back of the thyroid gland, you should have these parathyroid glands that are associated with it. Okay. And then just to kind of recap what can occur, okay, so you can have decreased blood calcium levels. That will stimulate the PTH to excrete parathyroid hormone. Okay, that gets in the blood system because it's a hormone. Remember, blood's taking these around. Okay, that can stimulate bones to start releasing calcium, so that will stimulate your osteoclasts to start deteriorating some of the bone material, kick calcium back into the bloodstream. It again entices the kidneys to conserve the calcium. Okay, and same thing with the intestines to reabsorb the calcium, all of which can kick the calcium back in the bloodstream. And we've talked many times about the role that calcium plays in different systems, whether that be your nerves, whether that be bone growth, just the ability to stimulate skeletal muscle is all associated with calcium that's in the system. Okay, so really important. But it can also have a negative kind of feedback. Too much calcium in the system will inhibit the PTH secretion. So if you have lots and lots of calcium in the bloodstream, okay, it will not trigger the PTH hormone to be secreted, and therefore these things don't happen. All right, next up we'll talk about a couple more regions that are important for the production of hormones in the human body.